So we got to get into some definitions. If I don't use definitions, we're going to be confused all day. So a mirror, there's kind of three things I want to go over. Mirror, image, and relationships. Mirror is basically something you have, another one of. Okay? So a mirror of my hand is a mirror of my hand. I got all the same things, right? It's a mirror, exactly the same. Also a mirror would be my hand looks like my foot. 5 fingers, 5 toes. It's a mirror. It looks exactly the same. My upper arm, my humerus, looks like my femur. My radius, or my radius and my ulna look like my tibia and my fibula, right? Everything looks the same. It's a mirror. So a mirror is something we have something of. I have another radius. I have another foot. I have another bone that looks like this. That's a mirror. An image is something we don't have something of. So I only have one set of lungs. There's no other place in my body that I have lungs. So how do I treat my lungs? We have to make believe. We have to make it up. We have to image it, right? We have to say, okay, Brad, you've only got one set of lungs. You've only got one heart. Where do we find a heart? Where do we find a lung? Where do we find a pancreas on your body? Where do we find this thing that you've only got one of? Oh, I've got to make it up. I've got to image it. I've got to make believe. So that's kind of the definition. When we talk about a mirror, be thinking, oh, there must be something just like this somewhere. If we're going to mirror the hand, it would mirror the foot. Or we mirror the hand, it mirrors the other hand. Something we already have something of. The definition of the image is we need to make something look like it, because we only have one. So don't get confused on the definitions. The other one is relationships. And so I don't mean relationships like boy and girl. I mean relationships as in like for like tissue. So in Macedonian relationship, if we're treating a muscle, we need to needle a muscle. If we're treating a bone problem, we need to treat the bone. We need to treat a tendon problem, we need to treat a tendon, etc., etc., etc. The other relationship is what I call a homologous structure. Probably one of your most powerful ways to use mirror and images. And what that means, that's somewhat like a mirror, but it's not. A homologous structure would mean I have a piece of anatomy that looks and acts just like another piece of anatomy. So if you look at my shoulder, this is I probably should have worn shorts and a t-shirt, but that'd be inappropriate. But if you look at my shoulder, it's a ball and socket joint, correct? Yes, it's a ball and socket joint. I got a humerus, it's a ball and socket joint. My hip is a ball and socket joint. I got a femur, it looks just like my humerus. The way my leg articulates and does things is just like my arm. If you go to the back side of my hip, I've got a posterior glute. I've got a posterior deltoid. These homologous structures look just like each other. Very important from an imaging perspective. So when I talk about homologous structure, that means, like, what's the best way to treat piriformis syndrome distally? You may say, well, Brad, use the hand, use the foot. No, the best way clinically, all day, every day, and I'll bet anybody this, treat the teres major. Because the teres major attaches your scapula and flares out to your humerus. Just like your piriformis attaches your sacrum and flares out to your femur. If you treat that teres major, even teres minor, but teres major is even better. You treat the lateral edge of your scapula, the teres major, and we'll get more into this. If it's complicated, don't worry. You, 100% of the time, will fix the piriformis where it attaches to the sacrum. Very nice way. Why does that work so well? Because it's homologous. That means same structure, same action, same function. Very important. So we'll talk a lot about those. And so when I say relationships, that's what we're talking about. Just like in Macedonian acupuncture, we have 7701, 02, 03. Those are called straight spine needles, I think, or upright tendons, sorry. They treat what? They're in the bottom of the foot. Again, it's not important. Don't worry. That's the theory. It's the bottom of the foot. It goes through the tendon and it touches the bone to treat neck pain. Now, I will bet you dollars to donuts, if you go through the tendon and don't touch the bone, you won't be effective at treating neck pain. Because typically the neck pain is within the cervicals, within the bone. If we got a bone problem, we got to touch a bone. We got to fix a bone. You've got to go through the tendon and tap the posterior side of the radius that will change. If you don't hit the bone, your needle will only maybe be 50, 60% effective. You tap the bone, 85 to 90% effective.